Oh, nice.
Did you know you could...
Oh.
Yeah, oh is right, right? The things you learn.
Well, we've been doing this for a year.
A lot longer than that. So there's that. Here's Brendan.
Yo, Hugo, you went to Kilo yet?
No, not yet.
Yo, what?
Moving like crazy. Just busy.
Hey.
I don't even have time. The only day I have off is Sunday.
Yeah, that's the only day.
Live things sleep in. All right, so thank you everybody for coming. Today is non-session fundamentals. We have Dr. Jay and Company here, Brandon. You were here, guys. Say hi.
Yeah.
And we are, honored to have you here. Ready for you to share all your knowledge.
Sweet. No new faces. Great. We go straight into it.
Yeah.
All right. First of all, I want to introduce Brandon. Brandon over there. He's one of PhyziX's newest intern. He's going to be a physical therapist. He's starting his DPT program at Northeastern University. So he'll be helping us with a little bit of things here and there. Okay. All right. Cool. All right, we're going to be nerding out today. We're going to be talking about anatomy, joint ankles, biomechanics, all that stuff. But you guys are ready for it. No need to introduce myself. Y'all know me by now. All right, so today we're going to understand the concept of a neurological center in our body. We're going to appreciate coupled motions as it relates to the hips, pelvis, shoulder, and even into the neck. And we can map all that out. And some exercises that you can do for quick changes. So one of the things that we do at PhyziX that we're proud of is that we treat more chronic type injuries. So acute injuries is what happens if you twist your ankle like last week. You go to a physical therapy office, there's a set protocol, get the range of motion back, get the swelling down, things turns out pretty all right. But the majority of injuries are actually not acute. It's more chronic. These are injuries where it's on and off for months. And these are injuries that have no traumatic onset. It just kind of came out of nowhere. That's where most people see pain in their body. And they go to a physical therapy clinic and then they do the same exercises for someone with acute pain. They still go ahead and do these circles with their ankle. And it's like, well, I can squat, I can run. I don't need to be doing ankle circles. So what's the missing link? Couple motion is one way that we use to help map this all out, to understand the framework to how to treat these type of injuries. So control of movement, we have muscles, and then we have joints, and then I say we have the nervous system right after that. So muscles attached to joints. So joint angles can affect the length of a muscle. So if I hold my bicep like this the whole time, I'm going to have a certain length for my bicep because of the angle of my elbow joint. And what controls this joint mechanic? The nervous system. If we broke our shoulder and we held ourselves in a sling for a long time and we haven't moved it, it's going to be held in that position because neurologically we forgot what's it like to extend that elbow. Pretty easy to understand. Next one. So neurological center, everyone has a neurological center. That means where we want to position our joints in space, right down the middle. And most of us are a little bit off-kiltered. Everyone is asymmetrical to some degree, but when it gets too far to one side, then we start to deal with some problems. So for example, if someone have like a favorite side of the couch that they like to watch TV on, they go like this all day, and then they come out and they sit at a desk, and they come back to this and they sit at the desk. Their neurological center is somewhere over here. And they might operate in this space for everything. They might lift in this space, bench press, squat, all shifted a little bit to one side. So what do? We try to find out why that is and see if we can bring them closer to a more symmetrical point. So coupled motion, what is coupled motion? Simple. It's when one joint moves, there's a predictable pattern for how an adjacent joint should move. That's all it is. And when we don't have coupled motion, what happens? We have decline in movement efficiency and we have decline in strength. So we're going to go experience coupled motion in our body. So everyone can stand up. This is active. So, oh, Melissa, come on in. Oh, sweet. All right. The first couple of motion, I want to look at the rib cage influence on the scapula and the pelvis. Now, rib cage, if I have a rib cage that depresses, and we have a rib cage that elevates, we're just going to see what happens to the scapula. Now, if we look at a rib cage elevation, that's going to couple with an anterior tilt of the pelvis, right? We have a rib cage depression. It's going to couple with a posterior tilt of the pelvis, right? Now they're coupled together. That means when they move together, it feels smooth. When they move against each other, it feels kind of awful. So I want you guys to experience a little bit of that. So go ahead and just depress your scapula, your sternum down here, and try to see if you can move your pelvis without lifting your sternum. It's impossible. So we follow a certain rule in the body, that we should abide by. And when it doesn't happen, the body functionally doesn't work very well. So now we look at what's going on with the scapula. With an anterior tilt or depression, what happened to the scapula? Abduction, external rotation, protraction, right? And if we go elevation, we just get the opposite. Depression, adduction, downward rotation. Everyone got that so far, right? And remember, oh, actually, we'll go to the next slide. I don't want to spend too much time here. So we got this drilled down. Let's talk about deadlift. Quick second for deadlift and how couple motion relates to that. If you get someone on a deadlift and you're trying to get them to hinge, but they're stuck in rib cage depression, do you think we can get them to hinge very well? Not at all. I don't like the cue where people say shoulders back and down, because you can get shoulder back and down, but nothing happens here. That's not going to change what's going on in the pelvis. So what we want to cue is a sternum up and then hinge. And you guys can feel that in yourself. If you just keep your sternum down and try to hinge, you're not going to find your glute. You're not going to be able to open up your pelvis versus sternum tall and go back. Now you have much better access. So that's a very simple way that we can apply couple motion into lifting and mechanics. All right, now we get into a lot more fun stuff. What happens when one hip drop? That's when everything starts to move. I'm just going to get a volunteer here. What's your name?
Christian.
Christian? Jay, nice to meet you. I don't think we've met before. Can I use you as an example? Okay, cool. So with a hip drop, we're going to get coupled motion in the entire body. So if you look that way, can you drop one hip, just bring one hip, load another one? Okay, so he's off axis right now. Right here. Okay, now come back up and drop the other hip. Okay, got it. So his body doesn't actually move according to what we call the rule of coupled motion. Come back up and try to get on the other side. Okay. So if you let one side drop, well, we look straight ahead. What we normally see is also movement in the shoulder blade here. So come back up and drop the other side. Good. And come back. Now drop this hip again. Okay, you drop this one, right? You drop this one, drop this one, drop this one, keep going. You see how his shoulder blades start to drift and turn, right? And come back up and drop this one. Drop this one, drop this one, drop this one, drop this one, drop this one. You start to see the movement starting to happen here. That's couple motion, and you can go back here. So what happens with a left hip drop? If I have a left hip drop, I'm going to have a spine that's going to drift towards what? This way. And I'm going to have a scapula that would downwardly rotate on the left. Left hip drop, downward rotate on the left. And upwardly rotate on the right. This is huge, right? I get this. And what's going to go on with glenohumeral abduction and adduction? This is closed chain, because we learn everything in open chain. We know this is adduction, and this is abduction, this is adduction, right? But if I'm going like this, is my right arm adduct or abduct? Adduct. Okay. Why?
Because it's getting closer to the center,
Okay. And this is
getting further.
getting further, right? So if I just take my hip, I come back to the center, we can start to see what's going on here. So one will be AB duct, one will be AD duct. Okay? So that's a general gist of what happens in the frontal plane. And we're going to start combining this into, all right, what happens when a person gets stuck in maybe one side versus the other side? What happens to that shoulder range of motion? What changes? So one exercise I like to do for people, I know we don't have a lot of wall space, but I'll show you guys. If we want to get couple motion back, that's a good one too, what you just did. Close. This is more simple. So we have someone who's, you look at them and they're like, okay, they're a little bit off kilter this way, and they're complaining with some shoulder issues. Instead of trying to target the rotator cuff or anything, maybe we just need to return them back into a more symmetrical position to live in. And this is a very simple drill that I like to use. Just go against the wall here. Brandon, you mind? I'm a videographer right here. So if I go here, and I take a knee, and I reach, I'm respecting couple motion. Now I'm getting this hip to hike. I'm getting this arm to go. Right here. Okay? Now you guys can try a little bit on the wall or find a wall and try this drill out yourself and just kind of feel, does one side feel a little bit different than the other side? So it's going to be the standing leg, that's the leg that you're going to be reaching with. That's the hand that you're reaching with. Yeah. So the nice thing about this drill is that when you have one hand on the wall, it keeps you on axis. You don't really shift away too much. Okay? Cool. And come out. That's all. I just want you guys to experience a little bit of what that frontal plane motion looks like. Oh, there you go. I'm going to use it. So I'm not the best at this. You can see on this side, if I draw a line, plumb line down the middle, I'm pretty straight. But if I do the other side, I get off axis. So when I lift my left like this, I got to get off axis for me to accomplish this motion. So that means my body's living a little bit off kilter towards the right side. That's all it means. Now, you can keep it simple. Keeping it simple would just mean just do it over and over again. That's how you would find a neurological center. So our nervous system is really good at finding the middle of anything. If I show you my forearm, you know starting point A, ending point B, you can find the middle very easy. The nervous system is very good at finding middles of anything. But you just need to know where A is, and you know where B is. If A is like this, but B is like this, or like something awkward, the calibration of the middle will be somewhere off the actual middle. Like if you end up reaching like this on this side, and reaching like this on this side, and none of this really moves, then we're going to be more biased towards this posture in our body. And we're going to live like this the rest of our life. So when you're doing this move for someone, I would just tell them, reach as high as you possibly can. Reach as high as you possibly can. You do it over and over and over again. Your nervous system will recalibrate, all right, what is the endpoint on the left side, what's the endpoint on the right side, and it'll find you closer to where that true middle is, and you will find a lot of the range of motion and the movement patterns. It starts to improve on its own without you having to do too much specific work for them. So this is simple, and this is when we use some foot mechanics. We won't go too crazy about foot mechanics. The only thing that's different between the third picture and the first picture, I just did it, the first one. The second picture, I just did it for a couple minutes and started to improve. The third picture was the biggest improvement. The difference was I used some foot wedges on the right foot. Because the way that our feet moves changes the structure of entire upper body. Like if I have a foot that's a little stuck in pronation, see how that forces my body into one side? So the foot mechanics start to matter a lot up the entire chain. We're gonna get a little bit ahead of ourselves here, but I just want to give you a little bit of demonstration of how interconnected all the joints are if we think about how these couple motions happen. All right, off axis. This one is where I want to spend most of our attention on today, because most people are off axis. Most people have two computers, and they have a mouse over here, a keyboard over here, and they're like this, and they do this, and they live like this for 8 hours. So the whole body's off kilter. It's not on axis. This is on axis. Everything operates here. They're off axis. Now let's think about what happens with an off axis to the right. So if I'm off axis to the right, that means my hip, without dropping, is over to the right. Everyone just try to do this for me. Just stand here and just try to bring your hip over to the right and watch what happens to your body. So you're a good example right here. So when you went over to the right, you see how your body shifted over to the side bend over to the left? Yeah, that's normally supposed to happen. Now, what if someone lives in this position? If our hip shifted over to the right, that means we have a side bend over to the left. That means we are going to have a left lateral flexion, a left outward rotation of our scapula. So that means this scapula is already upwardly rotated. And the right glenohumeral adduction, because it's closer to my body. And the left glenohumeral abduction, because it's a little bit away from my body. Now, why does all of this matter? I'm going to give you a real-life example right now. This is the client that I had. His neurological center is biased more towards a right hip shift. So this right here, that's his normal. Like not to the degree, but he'll stand like this with a little bit hip shift over to the right. Maybe it's hard to see, but that's what's going on. So left lateral flexion, a right downwardly rotated scapula, right glenohumeral adduction, left upwardly rotated scapula. Now, if he goes in this position, he raises his arm, which arm is going to abduct more than the other? The right? The right? Okay. So come over here since you have a pretty good example here. Sweet, man. Less close the better. All right. Cool. So if you go hip shift to the right, good, right here, look straight ahead. Now go ahead and raise both arms up. Go, 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 go. Stuck. Abduction right here, right? Good. And bring it back. Sweet. That's all I need to see. You're great. You're great. So that's exactly how we present it. He's coming here for a shoulder problem. And I go, okay, let's take a look. Is it a rotator cuff issue? Or no? There's no traumatic accident. He just started playing volleyball one day. He's just like, yo, my shoulder's stuck. I can't do like what I used to do. But there's no traumatic accident. So we have to look at how everything is all lined up together. We have to look at the coupled motion of the entire body. So everyone can see how what you had was what this person had, except he didn't look like this. He looked straight, but everything on the inside is shifted right. Now what we do, we just did some moves. We did some of these, returned that neurological center back, and now he's looking more symmetrical down the middle. Things have shifted more. And now this is how he looks now, right? And you can play with this for, if I'm here to the right, oh, I'm gonna get stuck. If I'm going hip shifted left, oh, my right is now stuck. So be careful when you look at his motion and you're like, okay, what kind of injury this is? It might not be an injury at all. It could just be a placement of joints. So the society really biased off-axis motion. Everyone loves to be on one side. We're all asymmetrical. You know, if I'm standing and getting coffee, I'll maybe lean on one side, or I lean on this side. And I'm always on the right side of my couch. I know that's my favorite side. I go to the left, I'm like, nah, I don't like that. That's my wife's side. And as the nervous system loses natural coupling of the joints, we start to lose movement capacity in our body. And in my experience, whenever someone has couple motion in their body, like when one joint moves, the other joints move how it's predictably supposed to move, they tend to be in a lot less pain, they tend to move a lot better, they tend to be stronger too. So a side glide exercise. So look at this one. So it's a great warm-up move. This is something that you can just teach anyone as a warm-up. First of all, I'm going to see if you guys can even hip shift to one side versus the other side. So all of you guys can go and here, and without dropping the hip, see if you can bring your hip out to one side. Cool. You got it. Let me see you move. Just kind of go side to side. Side to side. Everybody go side to side. Right. Good. 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 Perfect. All right. Now, the next step. Some of you go side to side, but instead of going like this, your body might go like this. It's a little different. And some of you go side to side, but instead of a pure shift, you guys go and drop the hip too. And now we have a different shape in our body. So this is the move. You're going to go bring your hip out to one side, and you're going to raise the arm on the same side that you're shifting towards. Just straight up and look straight ahead. Reach, 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 reach. And what you will notice that you will reinforce this side bend to the opposite side motion. And then come back and shift your hip out to the side and reach. Reach, 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 reach. Good. And you will notice your rib cage rotating. You'll notice your scapula starting to move. And you go to the other side. And you reach. The whole time you're looking straight ahead. And back. And the other side. Okay. Look around. Back. Straight the other side. Good. And the other side. Good. Excellent. So what are some exercises that you can do for some clients who are dealing with this issue? The kettlebell windmill is a great one. You guys know this one? You have a kettlebell up here, and then you just go and bring it back. What I would even suggest, I would shift your hip over and do it. Let's see if we can get them to do it with the hip going like this. If they're going like this and they're doing this, that's a completely different motion. You guys can try it right now. If you guys pretend like you have a kettlebell here, and you shift your hip out to the side, and then just trying to go and come down, you're going to feel a nice stretch through the front ribs there, right? Good. Now, if you go out to the side and also kind of drop the hip and rotate, you're going to get a lot more, but you're not going to get it from here. You're going to twist a lot in through the lumbar spine. Over time, that's not going to feel very good. So watch for the hip shift. Watch for when it's even or when it's not even. And there's a time and place for when we do want to drop. When we're on axis, we want a drop. That's fine. But if we're looking at off-axis motion, we don't want to drop. So it's what you're looking for. So can anyone tell me what's wrong with this picture here as far as what we know about couple motion and the off-axis motion?
The center of mass is being shifted to the right. And then the pelvis is going up. So what we see is like being thrown up. So therefore ABD, ADD on ABD and ADD on the shoulder.
Mm-hmm. So it doesn't respect what I call the rule of couple motion. Like if I'm going like this here, I should see this shoulder sort of get stuck. It's supposed to. Because the scapula is already upwardly rotated, it's going to run out of room. It doesn't make sense in that. But people are so smart, they cheat. They go like this, and they're like, you know what, I don't like this. I'm going to go like this. Right, and I'm good. But I'm still shifted to the right. But I cheated my way out of being able to accomplish this task in a roundabout way. Or I go like this, and I might, instead of doing a hip shift, I might just drop this hip, and I go And that will bring this shoulder back down. Now I can go up again, right? So these are things that you can start to look at. So when you're doing this move, make sure that this is actually doing what it's supposed to do, not just going this way. Time and place for it. Okay, hip adductors. You guys do adductor stretches? Open up adductors for your clients? Okay. How do you do it? How do you coach it?
So I normally just do like some like lateral lunges or something like that.
Yeah.
Like dynamic warm-up type setting.
Yeah, can I see?
Just come here, maybe give an overhead reach, try to keep this foot flat.
Right.
And come up, switch sides. Do the same thing.
Nice, nice.
Or like quadra.
Sweet.
Right here. Maybe rock back a little bit. Or a little bit.
Sweet. Cool. Anyone else? Do some adductor stuff. What is it? Side planks. Cool, cool, cool. Anyone just do some straight up, like inner thigh stretch? Yep, you get that done? Cossack squat? Perfect, good. All right. Let me see that. Go to the right, Brandon. Okay, got it. I might go all the way to the right.
All the way to the other side?
Yeah. Good. You feeling good stretch on your left adductors there? Go on to the left side now. Got it. And go to the right side again. Maybe it's hard to see, but you can tell that the left hip starts to drop a little bit when it goes to the right. Just nitpicking on you, that's all. Let's see what else we got here. All right, cool. So the adductor is very important for our ability to be able to shift side to side. And a lot of clients that you're going to see, they're going to do something like this when they go. They're going to drop the hip like this or something. And they're not going to get a pure slide. And they'll go over here, and they're like, well, I don't really feel too much over here because their hip is all the way dropped. You might get a little more glute, but you're not going to get that hip shift. Same thing over here. So one of the important things about the adductors is that it has two attachments. They have a posterior and an anterior attachment. So for us to get a nice stretch here, you will have one leg. I think I have the instruction on the next slide. Oh yeah, we'll go here. So everyone get into a Y split stance. You're going to have one leg a little bit in front. The trailing leg is going to be the one that's going to where you're going to feel the stretch. Now you're going to do a little post tilt, tiny bit. Doesn't have to be a lot. And then you're going to go ahead and slide over this direction while keeping the hip from dropping and come out. And slide over and keeping the hip from dropping. You're kind of a little confused over there. Okay. Can you tuck in your shirt real quick? Yeah. Can I see you do it? Dude, you got some massive quads, man. Sweet. All right, let's see. Nice. No, we're gonna keep it level the whole time for this purpose. Okay, good. Let me see the other side. Sweet. And you get a nice stretch through the adductors on the trailing leg. Cool. Nice. So we're gonna add this with the arms. I go here, and if I swivel, I'm gonna go this side now. If I go over this direction, naturally, I would actually swivel in. If I'm going for the path of least resistance, I'm gonna swivel in. And from here, you're gonna take this arm and you're just gonna reach up in the air. And you're gonna feel all that movement happening in the upper body, as well as getting a stretch through here. Good. Come back. Boom. Come back. And let's try the other side again. Wide stance. You're going to bring your hip over towards that side. And you're going to reach.
Would your feet position matter?
Your feet position does matter. You want to keep them both flat.
In terms of like your pointing your toe, like keep it rather or rather than whatever comes along?
Straight would be ideal. Straight would be ideal.
You said there's a posterior and an anterior insertion.
So you can, so for one of them, you would just drop the hip to get it. But I'm more specifically talking about the anterior insertion in which you will have to tuck over to do it, because we're talking about a hip shift.
Yeah.
If we want to get the adductors from a frontal plane, we would do this motion. But we're not going to talk too much about that right now because we're just focusing on one. Golf? You thinking about the golf swing? We're gonna connect that in a second with the golf swing. I think you'll enjoy that. Is there some kind of hip shift in the golf swing? Oh yeah? Now what will happen if we can't hip shift? What we're gonna have to do, we're gonna have to do this, right? And we see that all the time. Instead of a hip shift, we get a hip drop. It throws off the entire swing. It throws off our ability to be able to rotate around this way and come back because of what's happening here. Now we're going to talk about on axis. I don't have a step for everyone, but we can still do it. If I take one foot and I reach it behind me, that's going to drop the hip. Right? One hip's going to drop higher than the other one. And for us to maintain on-axis contact, we're going to take the right hand and reach up at the same time. And come back. And we're going to try not to hinge. We're going to try to stay perfectly tall. Reach back and go. And how's it feel for people when you guys are doing that? Hips.
Essentially, what you're trying to do is take advantage of that coupling.
Exactly.
Exactly.
We're taking advantage of the coupling here. And you guys can look at the other side and see how that feels. One side you might feel, oh my God, it feels awful for me. My back hurts, my hip hurts, my ankle hurts, or whatever it is. And the other side is like, oh man, this is smooth. Yep, reach back and reach right up. Your nose, sternum, knee, they all form a straight line when doing this, because that's what we call on-axis movement. Who feels awful on one side and feels really good on the other side? Which side?
Left side.
Let me see. Left side feels awful. Okay. Okay. And let's see the other side. Okay, can you come over here? I'll fix it. Can you tuck your shirt in? So we'll break this down and see why he feels awful on one side. So go to the side that feels nice. All right. So here you can see like the drop that's happening here, right? Good, and come back up. Now let's see the other side. Is the drop happening here? Not really, right? So we can bring it back up. Maybe the reason why it feels awful because you don't really know how to drop that right hip, right? So we'll do a little bit of a drill here. So if I take, actually, let's see your side glide. Can you slide side to side? Okay. Can you see that when he goes over to the right, automatically he wants to drop that hip? Yep, versus when you go over to the left here, it stays pretty leveled. So come back this way. Yeah, so neurologically, he doesn't really like that side. Can you take off your shoes?
Yeah.
Cool. Can we try this one where you glide over to the right? How's that feel?
Feels fine.
Yeah, keep going all the way through. And you feel the length happening right there?
I do.
Okay. And let's see the other side. And how's that feel?
Feel as much of a stretch.
You don't feel as much? So we're going to put a wedge on. I keep it in my pocket all the time. Keep it right here. Now try it. Feels different, right?
Yeah. Well, feel the lengthening.
Keep going and feel, and I'll explain what's going on. So why is that important? If we need to open up length right here, we need a supination foot on here. We talked about couple motion in upper body up to the pelvis, but couple motion starts from the foot all the way up through the entire chain. So we can get what we call a right foot supination mechanic and go, we will be able to open up that adductor on the right side. So if I were to summarize, maybe that right foot doesn't really supinate very well versus the left. And that's causing all of these movement patterns to have a domino effect. Now, after doing a little bit of that, let's see here.
What do you do if it doesn't supinate very well?
The foot?
Yeah.
That's a whole different thing. There's ways to supinate the foot. I don't want to get way into it because that would be like, yeah. That's when we talk about foot mechanics, because we can take this couple motion and apply it directly at just the foot, fix that, and then watch the effect go up the chain one by one. Everything just start to unlock and fall in the right place. So from here, let's see a side glide. Okay, left and right, left and right. It's dropping a lot now. You can see that. I don't really want that drop, but let's see. Try bending one knee and allowing one hip to drop. Okay, good. Try the other side. All right, keep going. I'm gonna hold you right here, relax your arm. Go ahead, do it again. And just yeah, go ahead. Yep, and when you do this, let this upper body move. You ready? Good, and come back and try the other side. See how the upper body didn't really move much? I'm gonna help you out a little bit. See how, there you go, look straight ahead though. Is that okay? Yeah. So that's the kind of what we can expect from a frontal plane on axis motion. Come back and do the other side. Okay, and come back and do it again. There you go. And do it again. Good. And let's have you do a few about me. Go. Good. Now, which side you have trouble dropping again?
I believe this one doesn't want to drop.
Yeah. So drop this side, but this time I want you to reach up with the right arm at the same time. How's that feel?
Feels like
all,
back here is like opening up.
Is all.
Something open.
Now go to this side again. Yeah, smooth. All right, and come back, and then do this one. Smoother, but not perfect, right? But it's just from practicing. Keep going this way now. Boom, look straight ahead. And then go. Good. And come back. And good. Yep. Press it down. Good. And then go. Drop this head. How's that feel?
That feels better.
That feels better. So all we did with the wedge, we gave him a little bit more of a supination motion at the foot, and everything started to unlock itself. Go ahead and do the other side. Boom. And then boom, the other side. Yeah, starting to look better. Now try doing that move again. Let's see. And that's pretty much the same move as before. Okay, and try the other side. Okay, that's smooth. And then the other side. And how's that feel right now?
Feels a lot better on this step.
All right.
Yeah.
That's just manipulating how your nervous system perceives this frontal plane motion.
Yeah.
Thank you.
Yeah, thank
All right.
you.
So the motor is nervous system,
It is the nervous system.
joints, and then muscle.
Nervous system, joints, muscle. There's no hierarchy, but that's the way I like to look at it. It helps me organize my information a bit better. Because if your nervous system never experienced this, it never knows how to get in this shape, whenever you do things that requires this shape, it's going to find another way to get there. It's going to be, okay, you can't do this. Well, I'm gonna go this way. I'm gonna go this way. We're going to have forces go into spaces that we probably don't want. Off-axis motion is a natural movement mechanics transitional phase of gait. You guys seen the rest of my other workshops, you guys know about the stance phase, in which one foot's here, this hips drop, heads forward. It's called a stance phase, which is just a space and time where I'm transitioning. But the transition phase is where the hip shifts happen. If we break down the gait cycle to it's like milliseconds, we go boom, and from here to go over there, we go boom, but we need to shift the hip this way, because we still have a body weight here. We have to shift the hip here. So this is the form that we have. And then we come into our stance phase, and then we transition. Transition phase, you see that in a lot of sports. Well, golf. Transition phase, as we come here, if I take this phase right here with this body shape and I put that right here, I'm in a golf swing position. I'm lengthening through here. But if I don't have the ability to shift here and I go like this, I still can swing, but I'm going to be maybe overdoing one, and I'm torquing into here, and I'm stressing my hip. So this transition phase is important. Follow through, same thing. We need some rotation, we need some hip shift, and all these motion needs to occur in everyday life. I mean, baseball, I'm not a baseball player, but it's a transition phase. It's the same mechanics that we need. So would it be too far-fetched to say if we can clean up someone's hip shift mechanics, doing some of these silly little drills, little drills, use some foot wedges, and have them clean up these motions in the sagittal, frontal, transverse, and off-axis plane, would they improve in their performance in their sport? Absolutely. And you don't even have to coach them. You don't even have to tell them, be like, hey, when you do this, I want you to hip shift. The body's just going to do it automatically because it's just a more efficient way of doing it. Like by the time we're done over there, I didn't have to coach them how to do this move. It's going to have that capacity because we practice. We've just broken down that pattern a little bit, and now we become more efficient at it. So it's sort of the shortcut of getting someone feeling better, getting someone moving better. We don't have to cue the actual action. We just have to have the nervous system experience its components required for the sport or for the action to occur. That makes sense? Perfect.
Quick question.
Yes.
How do we determine if, aside from pelvic like jump, shift side to side, how do we determine if it is either someone is doing from rear like transverse sport, like whether if the pelvis or whether it's like a socket doesn't have like that much like gap for them to shift it into. So I would think, at least without that knowledge, I would think that if someone can do this, they don't have like enough space in the joint capsule, so they can't build it up on that head.
Mm-hmm.
That's what I would think. So how would you determine if someone can shift the hip, or it's like they can like build it on that hip?
You gotta test it.
Okay.
Well, we test it on a table, but it's not really accurate too. Because if the joint is stuck in this position, you put them on a table, they're still gonna be in that same position, so it's still gonna match the same way. But what's the cool thing is after we come out here and we go through these couple motions and have them restore some of that, we go back on the table, the test actually improves without us doing really anything at all. So as far as hip capsule, yes, I understand that. But we gotta understand how that relates to couple motion, right? Like if I have a sternum that can go up this way, I'm gonna have a pelvis that can anteriorly rotate, and I can have sacral nutation, which will open up the capsule. But if we're stuck here, we're not really gonna have a good chance of opening this. So we still have to look at, well, point is we have to test it, right? If there's ways, like if someone is moving like this, and I notice the foot is not moving at all, it's like a piece of rock, it doesn't move, well, of course we're gonna need more range of motion here because we're lacking over here. So we're always going to need to borrow something if we don't have what's required. Does that answer the question?
Yeah.
I'm sure we can go like a whole couple years about that one question, but that's the general gist of how we'll look at it. Oh, we got a little bit extra time. So mapping out the entire sequence, neck. How does the neck and the feet, how do they connect with each other? Well, we can map out the entire thing from couple motion. So left cervical rotation. For us to get left cervical rotation in a closed chain manner, isn't that the same as just having a right torso rotation, right? You can agree with that? If I rotate my torso to the right, I'm technically rotating my neck to the left. If I rotate my torso back, I'm rotated left. It's very easy to see. Now, what do I need for a right torso rotation? We need a relative left pelvis rotation, right? If I rotate here, my pelvis is technically rotated left. So that means I just need my right foot forward like this. Because if I have my right foot forward, we're going to have a pelvis that's rotated left. And for us to face forward, we need a torso that's rotated right. And for us to look forward, we need a neck that can rotate left. So can we improve left neck range of motion just by having the right foot forward and doing a move in which is pressing with the left arm, in which we can have everything counteract each other? Yes, we can. That's exactly how it works. And if someone is stuck in a pelvis that's rotated to the left and a torso that's rotated to the right, and I'm here, that neck range of motion will start to decrease from one direction to the other, right? Like if you have a torso that's rotated right and you look ahead, go ahead, and you try to rotate it right, you're not going to go very far because you're already in a right rotated state. If you have a torso that's rotated right, you're going to have a stuck left rotation. It's almost common sense when you think about it this way. But what we don't think about is what else do we need for all of this to occur normally. So rotational activities I love to do. Sometimes I just have people stand here and I just have them go bring the arm out this way. You can think about flies. If I keep everything still and I go this way, I'm going to improve right neck rotation. If I stand here and I go to the left, from the left to the right, I'm going to improve left neck rotation. All these things. So for our spot people here, how would this apply to some things that you do for your clients? Well, if you lay them on a table, sometimes you can see them off to kilter towards one side. And usually what you can tell is just, all right, what's tight, what's going to be more lengthened. If I'm standing like this all day, we know we're going to be a little short in here, we're going to be a little lengthened over here. We could work on this side of the rib cage so they can come back. Rib cage is one of the biggest things far as massage is concerned. I know, Melissa, you experiment with this from some of your folks. If we can get the rib cage to feel loose, they can breathe better, they can move this around better, and that's going to translate to how the neck moves, how their hips move, how the feet moves around as well. Okay. Now, we only have a couple minutes. I want to open up the floor to some questions because these things can get complex real fast. Is there any particular regions of the body or questions? Here we go.
This one probably might be a dumb question. Rotation to the right, I have limited. Now, you have like a fusion in your neck. I'm guessing there's not much this movement can do, or are there, if I have a fusion in my neck,
Yeah.
and I'm going like this, is there any value
Yeah.
in that, even with the fusion?
Yeah. Well, you want to get as much movement as you can,
Yeah.
right? But let's say you have a fusion in which you can't turn to the right,
It's like right here.
right?
And then this one.
Right. That means your body can have to make up for that loss of motion somewhere else.
Yeah.
That might mean you need to have a torso that's more rotated towards that side in order for you to turn more,
Yeah.
right? So how much more? That's the question, right? Is it like all the way here? Is it giving you too much help? We can still balance you out by just having you come back and forth. right? So we'll do a little bit of rotation right now, and this is a drill I like to use, very simple. I bend their knees a little bit here, and I have an arm that comes up like this, and I have this back arm that comes to the back. And I don't want to force this motion. I don't want to like, yank it out, because I just want to lift it, and I just want the feet to feel even pressure, and watch as my rotation go off to the left. And then I'm going to go this way, and I'm going to watch my rotation go to the right. And I go back and forth. And what I want people to notice is when I do this, does my weight shift all the way over? Am I doing something funky when I go this way? And when I go the other way, am I just straight down the middle? This is an on-axis motion. On-axis motion. Ooh, on-axis motion. But I'll be careful not to muscle it out, because if you muscle it out, too much tension in the body, the joint doesn't have a chance to move. Back arm, right?
I find myself in the back arm trying to like compensate.
Yeah. So if you're having like a back arm on the left, that's coming back this way, that's tough. Well, we can map this out. All right, we need a left torso rotation, so that means we need a left foot in front. So maybe you will like to do some more exercises with your left foot in front and doing some pressing with the right arm, and that's going to rotate you towards the left side. You might have the bias towards that, but come over here real quick. This is just quick. So do what you just did. See the rotation of the pelvis already happened? So keep this pelvis in front. Now bring it back. Now go. Feel that difference there? Yeah. So you were cheating yourself out of that coupled motion. He went like this. I'm going to show you. He went here, and he just went like that. And you'll see that a lot.
But you want it.
I want you there. See,
You feel it. The rotation.
You can feel that rotation here. So the whole time, because you don't like this feeling, you're probably just doing this the whole time. So
I'll just.
Yeah. So you're going to feel good because you're going to be like, oh my God, my shoulder range of motion is great. But you're borrowing it from the hips because you're lacking it over here. So next time you go in here, maybe just press down onto your back heel so that you don't move the pelvis, and then you can start doing your move this way, and it's going to feel very different. And even from here, you can do your rows this way. Okay? Yeah. So couple motion is a way to really map out the whole body and really have it almost make common sense. They say, oh yeah, of course it's going to have to do this because it's lacking this. So you guys can take this, kind of think about it. This is what I wanted to give you guys is not a set of exercises that you can pull from, but it's a way to think about movement that can have you be as creative as you want. Because you don't notice someone that's lacking this range, you're like, all right, why is it lacking? Go follow that chain, what happens? And can you design certain exercises that will do that? Like, can you have someone who's doing overhead press, if you know they can't hip shift, can you have them just do it this way? Right? If you have someone who's missing frontal plane motion, can you have them 1 foot on the bench and then do their presses this way to work on that hip drop? Whichever leg in front would be the one that's hiked, and the one at the bottom is the one that's bottom. Go ahead. Yeah. Cool. So, excellent. Well, you guys know the drill about how we work. Anyone that we see that you send us, we want to make sure that they stay training with you guys. So all these modifications that we do, maybe like, hey, for this person, when they do presses, just make sure the left foot is on something versus these modifications is kind of easy, but it can have a profound effect on how they move afterwards as far as movement efficiency and pain-wise. The referral program, we simplified it, super simple. $100 off for any client that you refer or any person that you refer, and then we'll give you $100 for when they come, Viore gift card when they come and do their evaluation. And then 3 or more referrals, we'll hook you up with a pretty cool massage somewhere nice. And that is pretty much it. You guys probably all already follow me, but just in case you don't, give me some more followers. Any questions, last minutes? All right. hey, feel free to ask me questions on Instagram, email, whatever it is. I'm happy to answer any of these things. I love nerding out on this stuff. It's my passion. It's what I dedicate my life to. So if you guys want to have that discussion, I'm always open for it. Cool.
I have a question
Yeah.
for Keisha and I as massage therapists. Starting face down, I know you and I spoke. What would be the best position to go to a face cradle? Remember how we
Face
were talking
cradle.
about the breathe, the breath?
Yeah.
What would be the better position? Maybe you should have Keisha.
Yeah, so face down position, I think a lot of people struggle with it only because they can't get into this shape of their body. So they're stuck here. I will put their head down this way because if you put them like this, it's just gonna crank into that end range. They're not gonna feel very comfortable. Face down, if they're really kyphotic, if they're really like stuck here, I would even put a bolster here or like something here to angle them towards that position that feels more comfortable. And as they feel better and looser, maybe take some away and they can slowly get back into that position. Face down is great, it's just most people can't tolerate it based on how their body shape is at this current moment.
The face up is always the best way to start for breathing.
Depends, this gets a little bit more complex because where you place the body with gravity is gonna dictate where the breath is gonna go. Like if I put someone on their chest and I have them breathe, we're not going to expand too much here, so we're going to have some expansion in the back, which is good. Most people need that. Most people are very stuck here, so expanding through the back ribs is very nice. If I have them lying on the side, we're going to be more compressed on the side that's down, and they're more likely going to breathe into the upper side of the body. So positional exercises, breathing, where you place someone, all makes a huge difference. I'd say the most comfortable position for the person, whatever they prefer, is going to be the best choice. As far as lying on their back, elevated pillow would be nice. Most people cannot get into a neutral neck. They are stuck here. So accommodate that for that. Yeah. Does that answer the question there? Perfect. Love questions.
As what you just mentioned for brief breath work, if someone is, let's just say, shift like this, I would say it's like breast expanding. So, and it's just like a breathing breath work before we even get to any movement or whatnot. You can just put them on the side, and you can like lay on the side and then just have them breathe, so then this space can expand. Would that consider as like one of the breath work to get?
I mean, you can be very specific if you like. I like to go very simple. I do both sides. Like if you have like a roller or something, I might put their ribs on top of like something and I'll have them go like this. So they're curved here and now they're open here. And then they can do some breaths here. And then you go on the other side and do the same thing. So you just cover your bases. I wouldn't go, you can go really crazy and in depth with and specific with that type of stuff.
Right.
I like to just make it simple as possible.
Would that make a big difference if you go with that specific detail, or I wouldn't?
Absolutely, absolutely. It's just how deep you want to go, you know? Because if you open up on the side like this with someone who's missing this frontal plane motion, it will clean that up because you're able to open up the space. And then now they're moving better like this. And now they're running better and all of that. But for all of that to stay, it's a key point. The foot needs to be involved in it. Because you can look really good on the ground, on the table, whatever. You stand up, you're on your feet, and then and then now everything is all messed up. So we need to make sure we look at foot mechanics and all that. That's why I'm so big on these wedges and how we look at the couple motions starting from the ankle, foot, and above.
Since we might not be as good as assessing these postures as you are, could you argue that maybe just incorporating all these different positional breathing supine from sideline into a program would just kind of guarantee that you just hit all angles?
That's perfect. That's exactly what I'm getting at. That's why I'm showing these exercises, because these are simple enough that you can just incorporate.
Yeah.
Like I would, if you're doing a lot of things sagittal, just hit the different planes. Like even if you're going frontal plane, I would hit frontal and then curve in, And if you're doing presses, put it on a step, and now you have a hip drop. And you can just do it on both sides. And you can have it on a step, but out to the side, and now you can do it on the same arm this way versus this way wouldn't make a lot of sense. You would know. You do it, and you're like, yeah, this feels awful. And then you go like this, right? Versus when you're in the front, now you can hit the drop, and then now it feels different. Yeah, absolutely. I recommend all different positions on your back, on your side, on your stomach. Exercises need variety. Like if you hit bench press, deadlift, squats, what's the last one? Whatever. They're all sagittal plane on your back and in the front and sagittal. So you're not really going to improve any movement efficiencies going that way. You get them really, really strong, but they don't walk around like this because nothing is rotating, nothing is dropping. Great question. That's absolutely all different positions. Cool. Excellent. Yeah, thank you. Thank you, thank you. Thank you. Cool. And I got something for you.
Oh,
I got something for you.
Oh, thank you.
Enjoy.